Let's talk about the differential diagnosis of Q waves. Two different types. The physiologic or non-significant Q wave, which is normal. There's no dead cells from infarction. The Q wave is normally produced in lead 1 by the initial depolarization of the interventricular septum, with electrical vector directed to the right and downward. Remember, the septum is relatively thin and depolarization occurs quickly, generating only small, short-lived potential. Thus, when we look at the morphology of the Q wave that's physiological or normal, it is shallow and it is narrow, less than one little block or less than 0.04 seconds. Next are pathological Q waves. This means cells have died. Remember, with pathological Q waves, they only indicate that cells have died. It is not time specific. The only way to determine that your pathological Q waves are acute is in the setting of ST segment, which is localized. Someone with a MI or who has killed cells can retain their pathological Q waves for the rest of their lives. If you've ever taken a transfer or looked at an old EKG, you may see old MI suspected or something to that effect. So remember, the only way to determine that you're currently having cell death is when you're currently having cell injury, meaning you're seeing ST segment elevation and you have Q waves that are present. These pathological Q waves are wide. They're greater than 1 block or greater than 0.4 seconds, but if you notice on the strip, they're also deep. The criteria for depth or your vertical height, voltage, is a Q wave that's greater than 25% the height of the R wave, looking at the red wave in the picture. So pathological Q wave criteria, greater than 1 block wide, and its depth is greater than 25% of the height of the R wave. Remember, in myocardial infarction, dead muscle tissue produces no action potential, and the electrocardiograph looks through this infarcted area to pick up electrical forces from the opposite side of the heart, which are directed away from lead 1. So pathological Q waves mean cell death has occurred. They're abnormal, but the infarction is of an unknown time unless it's in the setting of ST segment elevation. Thanks for watching.